Hello everyone. Next few minutes, I'm going to talk about emerging infections in tropics. As we all know, since 1940, there is constant increase in number of emerging diseases, mostly from wildlife-related zoonosis. The main reason behind it is human activity. And with the loss of biodiversity, it is the leading mechanism why these emerging infections in tropics are now more common. Before going in detail, let's understand the definition of emerging infection. According to the National Institute of Allergy and Infectious Disease, the emerging infectious diseases are commonly defined as outbreaks of previously unknown disease, either non-diseases that are rapidly increasing in incidence or either spreading in the geographic range in last 2 decades, or the persistence of infectious diseases that cannot be controlled. For example, HIV infection, SARS, Lyme disease, hantavirus, dengue fever, West Nile virus, or Zika virus. Now, if you look at the classification, it is broadly divided in 4 categories: newly, re-emerging, deliberately, or accidentally emerging infectious disease. If you want to give some example for this disease, a newly emerging infectious disease means the diseases that were not previously described in human. For example, HIV. Re-emerging means diseases that have spread to the new places or the diseases which is right now not under control by previous treatment. For example, any MRSA disease. Deliberately emerging disease means it is a diseases which created by humans for bioterrorism. For example, in World War I and World War II, anthrax was used as a deliberately emerging infectious disease. And if you look at the accidentally emerging infectious disease, means those are the diseases which are created by humans mostly because of some error. For example, vaccine-derived poliovirus. So, if you look at the global example of emerging and re-emerging infectious disease, Dr. Fauci has made an interesting map which shows the distribution of particular disease in particular geographic region. If you look at here in the anthrax, which was used as a bioterrorism in the North America, at the same time, here if you look at the South African countries, you will see more of yellow fever and other Lassa virus and other diseases, including Ebola virus. So there are a number of diseases which are right now considered as an emerging disease. But if you look at the prevalence of this disease as far India is concerned, okay, then only we have to consider that these diseases are really can happen to the community and it can affect a large number of population. So WHO endorsed expert committee, they have updated the list of current and future priority emerging diseases, and they have given almost 9 diseases, including Crimean Congo hemorrhagic fever, Ebola, Marburg, Zika virus, Rift Valley, MERS and SARS, along with Nipah, Lassa and Hendra disease. If you look at this list was given in 2018, but we all know that since last 2 years, our health sector is fighting with COVID-19, and this is also considered as a emerging disease because earlier this disease was not prevalent in most of the part of the world, but now it is almost pandemic. So this list of infectious priorities have been recently updated again with the addition of the novel coronavirus COVID-19. Why these diseases are important to know in our Indian context? If you look at last 20 years data, from 2000 till 2020, many outbreaks happened, including Nipah virus, which was there first in 2001, particularly in West Bengal. After that, again second outbreak happened in 2007, again in the West Bengal. Later on, the third outbreak of Nipah virus again happened in Kerala, which was in 2018. So like this, many diseases, including Ebola virus, Crimean Congo, Zika virus, and COVID-19, these all are prevalent in India as far as our Indian population is concerned. Let's talk about few diseases among them. Let's start with Crimean Congo hemorrhagic fever. This disease is spread by virus CCHF, Crimean Congo hemorrhagic fever virus. It belongs to family Nairoviridae. This disease was first described in 1944 during the World War II, particularly in Crimea. Again, later in 1956, the same outbreak happened in Congo. That's why this disease was named Crimean Congo hemorrhagic fever. Again, this disease is zoonotic in origin. There is also possible spread from person to person. This transmission to the humans occurs through the bites of particular ticks, which are known as hyaloma ticks. The last outbreak was reported in 2011 in Gujarat. Many farmers, particularly who are handling the animals, they got this disease. If you look at their epidemiology, the small mammals or birds, they will harbor these ticks, and from these ticks, infection will spread to primary human infection. Again, from the human to human, because of the saliva and other secretory juices, if they come into contact with other human beings, then secondary human infection can also happen. If you look at the incubation period, 2 to 14 days is the incubation period. Once the onset of symptoms starts, okay, this duration will consider as a pre-hemorrhagic period. And initial after 4 to 5 days, patient will have some amount of hemorrhagic manifestation. If patient is showing these symptoms, means almost 15% of the patient can have a mortality. If you look at the data, in last time Afghanistan, 59 deaths out of 483 cases were happened in 2018. If you look at the mortality, it will consider around 15%. So almost 1 in 8 patients can have mortality. Now again, if you look at the symptoms, they are non-specific like any other viral illness. Differential diagnosis include any other viral hemorrhagic fever and malaria, typhoid, shigellosis, or any other bacterial disease. But here it is very important to find out what was the patient history. Was there any exposure to the ticks? Was there any exposure to wild animals and livestock? Is the patient is coming from particular area or village which is endemic for Crimean Congo hemorrhagic fever, or there is any direct contact history with the Crimean Congo hemorrhagic fever cases? Once your suspicion is more, the diagnosis again will be confirmed with particular test, which includes RT-PCR, IgM, IgG, ELISA, direct antigen detection test through the rapid antigen detection test, and virus isolation by the cell culture. If you look at the management, again, there is no specific treatment for this disease. That's why early aggressive intensive care support in form of monitored fluid, electrolyte balance, renal function, blood pressure, and oxygenation. Here, if at all patient is having any coagulopathy, we have to support the coagulation system. Supportive drug therapy includes painkillers, antiemetic, anxiolytic, and antibiotics if at all the skin lesions are more. And sometimes in some studies they have used antimalarial chlorophyll also as a part of treatment regimen. The most commonly used drug as an antiviral therapy for this disease is ribavirin. The ribavirin can be given in an oral form, particularly post 10 days. The loading dose will be around 30 mg per kg, which almost comes to 2 grams, and followed by 15 mg per kg 4 times in a day and 7.5 mg per kg 3 times in a day. This should be continued for another total 10 days. Now coming to Ebola virus disease. Earlier, this disease was considered as the Ebola hemorrhagic fever. And the first identification of this disease happened in 1976 in Sudan, the village near Ebola River. Now, if you look at the pandemic or maybe the endemic data, in 2014, the West Africa, almost 28,000 Ebola cases was detected. From that, 11,000 patients did not survive. And if you look at the in last recent 2020, in Congo, again one outbreak of Ebola virus happened, and this time 3,400 Ebola cases were detected, and out of that 2,200 patients did not survive, which tells the case fatality rate is more than 50%. So this comes as a very fatal disease. And if you look at the etiology, the Ebola virus is itself coming from family Filoviridae. Generally, the first reservoir is the fruit bats. These fruit bats will spread the disease in the animals. That's why epizootics in animals like infected fruit bats enter in the direct or indirect contact with other animals, and the large-scale epidemics in primates or mammals can happen. From these animals, the infection can spread to primary human transmission. And once the one patient got affected, because of that, the other patient can also get the same disease through the blood, secretions, either organ transplantation, or particularly if health workers who are directly working in a close contact with the patients or patients' relatives. And this Ebola virus can persist in the body fluids or in patients who survive this infection for a longer time. And particularly, there is a high risk of sexual transmission of this disease even after patient gets recovered from the Ebola virus disease. Now, again, if you look at the infectivity period, particularly first 10 days, patient can be more infective. Initial few days, patient will suffer from fever, severe headache, myalgia, extreme fatigue, and conjunctival injection. Later on, they can get severe sore throat, chest abdominal pain, skin rash, or diarrhea or vomiting. And later on, if patient's condition worsens, they can have hemorrhagic manifestation along with altered sensorium, which can lead into coma. So diagnosis, again, the similar method, RT-PCR, ELISA, antigen detection test, or virus isolation by the cell culture. If you look at the lab parameter, the most common findings you will observe in Ebola disease is low WBC, low platelet, elevated liver enzymes. If you look at the how this hemorrhagic rash will appear on the body, this will mostly be prominent on almost entire body, skin, and there will be punctured hemorrhagic lesions will be visible. Treatment, again, there is no specific treatment, only the supportive care is there. But recently in 2020, FDA has approved two drugs, Inmazeb and Ebanga. These both are monoclonal antibodies. The first one, it is a combination of 3 monoclonal antibodies, while Ebanga is a single monoclonal antibodies. And these antibodies are not effective against species other than Zaire Ebola virus. The research drug, again, along with Rabipavir, here Favipiravir also decreases case fatality rate in the patients with a low to moderate viral load. If you look at the prevention, again, the Ebola vaccine is there since 2019, and this is the first FDA approved vaccine for Ebola. The antibodies can be detected in the blood up to 10 years after recovery. Coming to Nipah virus disease, we all know the last Nipah virus outbreak happened in Kerala in 2018. In this outbreak, almost total 23 cases were detected. Out of that, 21 did not survive. So these 21 patients who died because of Nipah, from them, 18 patients were RT-PCR positive. If you look at to the study where they discuss how they found the first index case, 26-year-old male who came to the hospital with encephalopathy and did not survive. Later on, after 14 days, the diagnosis was made from the 6th case who has a similar symptoms, who comes from the same community with the direct contact with the first index case. Now, Nipah virus disease, again, it belongs to the family Paramyxoviridae, and it is also a zoonotic disease which causes the severe disease both in animals as well as in humans. In human, it is a severe and rapidly progressive encephalitis, so the mortality rate is very high, and it can happen to the patients who are having direct close contact with infected pigs. Now, severe respiratory disease in pigs can also happen. If you look at the Malaysia epidemic study, the first time it was discovered in 1999, it was named after the village named Nipah, where the pig farmers, they became ill with encephalitis. Similar major outbreaks happen in Bangladesh, Malaysia, India, and Singapore. The mode of transmission was different in Malaysia and Bangladesh. If you look at the Malaysian trade, the pteropoid fruit beds, they are in the natural reservoirs, and because of that fruit beds, these infected fruits, which was consumed by the pigs, and then these pigs transmitted this Nipah virus to the people who were in a close contact with them. If you look at the Bangladesh study, here the fruit beds, they drink from the sap and they contaminate the sap with Nipah virus. When the people, they drink this date palm sap, they become the infected, and Nipah virus comes into the human transmission, and from there, human to human also it is possible. Nipah virus symptoms, again, incubation period is 4 to 15 days. The symptoms can include fever, headache, myalgia, vomiting, sore throat, dizziness, drowsiness, or it can lead to encephalitis or severe ARDS. The encephalitis and seizures occur in severe cases progressing to coma within 24 to 48 hours. And the case fatality rate, again, it is very high, which is 50 to 75%. If you look at the diagnosis, again, the similar method, RT-PCR, either IgM antibody by ELISA, or isolation of Nipah virus from the tissue, CSF, urine, or any other bodily secretions. The treatment, again, it is supportive care. It may require intensive care monitoring, particularly a patient who requires mechanical ventilation for airway protection. The ribavirin has shown 36% reduction in mortality during the Malaysian outbreak. Again, the efficacy is unclear. There is a new drug which is called monoclonal antibody M102.4, which is under research right now for the treatment of Nipah. Now, prevention is very important. So again, hand washing, practice and use of PPE is must. It is very must to avoid contact with sick bats or pigs. It is necessary to avoid areas where bats are known to roost. Avoid eating or drinking products that could be contaminated by the bats, such as raw date palm sap, raw fruits that is found on the ground. Avoid the contact with the blood or body fluids of any person known to be infected with Nipah virus. Unfortunately, there is no vaccine available at present. Now, coming to the Zika virus disease, this disease has again another last outbreak in July 2021, again in Kerala. A 24-year female pregnant patient tested positive for Zika virus, and later 13 out of 19 hospital staff also tested positive. Luckily, this disease has a very mild symptoms and a particularly high risk of miscarriage in a pregnant woman, and also a pregnant woman who get detected with the Zika virus, there is a high possibility of risk of microcephaly in their babies. Now, coming to the causative agent, single-stranded RNA virus belongs to Flaviviridae. Here you will see that it is closely related to dengue, yellow fever, and Japanese encephalitis, along with West Nile virus. Primarily, this disease transmitted through the bite of infected Aedes mosquito, particularly two species, Aedes aegypti and Aedes albopictus. It can also be transmitted from mother to fetus during the pregnancy, through the sexual contact, through the transmission of blood or blood products, and also it can transmitted through organ transplantation. It is a widespread disease, and it has traveled from African countries till in Asian countries. If you look at the symptoms, more of the symptoms are common. Acute onset of fever, maculopapular rash, headache, joint pain, conjunctivitis or muscle pain can have. If you look at the comparison between Zika, dengue and chikungunya, the fever is very much prominent in dengue and chikungunya compared to Zika. But if you look at, hemorrhage will be there in dengue, while Zika and chikungunya will not present with any hemorrhagic manifestation, and it will not have presentation like dengue, where the shock is very common. So, if you want to diagnose Zika virus disease, again RT-PCR and serological test in form of IgM and ELISA will be required. Here, one specific test is there, which is called as PRNT, plaque reduction neutralization test. Here, they will identify Zika virus and dengue virus antigen, and it is more sensitive serological test. But here, we cannot time the infection. Always it ran against the dengue 1 and dengue 2. The interpretation, as it is described here, if Zika is more than 10 and dengue is less than 10, means it is a confirmed disease. If Zika is more than or equal to 10, but dengue is also more than 10 or more than or equal to 10, means it is a probable infection. But if both are less than 10, then there is no infection of Zika virus. There is one entity which is called Zika and Guillain-Barré syndrome correlation. It is strongly associated with this Zika virus, but a very small proportion of people, they get GBS. And the symptoms will be weakness of arms and legs. In severe cases, it can also affect the respiratory muscles. It can last from a few weeks to several months, and most of the people, they fully recover though some have permanent damage. Very few people, they die from the GBS. As I discussed earlier, a mother who are detected Zika virus positive, their baby can have microcephaly. If you look at this picture, the most common birth defect is microcephaly. It can be a typical minimal, or it can be a moderate to severe microcephaly. Zika virus disease treatment and prevention, there is no specific treatment. Supportive care with adequate hydration is must. There should be a protection against mosquito bites during the day and early evening. And we should always prevent the breeding of Aedes species, particularly in stagnant pools of water. So, take-home message will be, emerging diseases can become endemic or pandemic if not identified and controlled early. Always collect a detailed history, including travel, close contact, workspace, while treating the patient who comes with fever. There can be a rapid worsening of sensorium with fever. You should think about Nipah virus too. Majority of these diseases do not have any specific treatment, but identification of active case, isolation of these cases, and use of PPE are important factors which can really control the spread of these emerging diseases. Thank you.